Thanks for joining us, Amanda. I was very keen to get your perspective as a former Immigration Minister of the role of cruise ships in this crisis. We've welcomed the cruise ship industry over the years. They've been subjected to state and health controls when it comes to the normal border and immigration processes, but obviously perhaps nobody foresaw just how dangerous they could be when it comes to spreading infectious diseases.
Well, look, anyone who's been on a cruise, and I've been on one once, will understand that there are those little things where you sanitise your hands just about everywhere on a boat. Now, you might think that makes you feel better, but it spooked the hell out of me because it said these are disease factories, they're bug factories. If an aeroplane is a bug factory, and I can assure you that it is, a floating cruise liner is just a bigger one, that's all, with more opportunity to bump into each other. I think people did realise it. What happened in Sydney was clearly a mistake. I don't know who made it. The federal government says it was the responsibility of New South Wales, and New South Wales says they made an assessment. It was low risk. Now, clearly that was wrong. But I don't think people think cruise ships aren't a problem. I think it was a bad assessment of those ships.
Yeah, Amanda, we're looking at pictures now of people filing into Sydney Airport today. They're obviously, we can go back to those pictures now. We have been looking at pictures of people filing into Sydney Airport today. Now, they're all not following social distancing rules. They're crowded up together. There's been a lot of commentary about this. Obviously, it would be better if they had more space. But they're all got to go into isolation for 14 days anyway, right? I mean, this is the key point with all these people. If you're coming into this country, regardless of whether you're an Australian citizen or not, you must be going into 14 days of complete isolation.
That's right, and good thing. And I heard from someone through a friend, a mutual friend, who's a very well-educated person who came back from overseas last week and said, oh, don't be ridiculous. Surely I can ring the local meat store and get my order ready and I can just drive past and they can drop it in. And our mutual friend said, no, you can't. You just have to stay home. Now, I don't know what people don't get here, Chris. People aren't being asked to go on the front line like our nurses and doctors are, every day wearing those masks and really shocking and putting their lives at risk. You're not being asked to do that. You're just being asked to stay bloody home.
Yeah, it's not too much to ask.
I don't think it's too much to ask to save lives.
And my take is that most Australians are following that very carefully now. There have been some unfortunate incidents, of course, in the past. There's always going to be breakouts. But my sense of the people I see day in, day out is that people are taking this seriously. They're being pretty phlegmatic about it and they're getting on with it. I did want to ask you also, Amanda, as a former ambassador to Italy for Australia, just your thoughts on what that country is enduring, particularly in the north of Italy, how that would be impacting on Italians there and back in Australia, and why the outbreak has been so bad in Italy.
Well, I think there's a number of reasons. There's quite a significant Chinese population working in the silk industry in northern Italy. And I think there might have been flights in and out of China well past the date they should have been allowed. Just relatives visiting each other, not realising what they were doing. Then I'm told, because, Italy's one nation, sort of. They say they have Unification Day, but, anyone in Milan thinks anything south of Milan is, a part of Africa, really. And if people in France think Rome is in the south, and people in Rome think Calabria is in the south. But there's hesitancy in northern Italy to do what people in the south say. So when the government based in Rome wanted shutdowns in northern Italy, apparently a lot of them, I've heard one estimate of being about 1 million, just got in their cars and came south.
Dear.
So before it could be enacted, people who were infected just swarmed south. So they weren't going to be locked down. It was the dumbest thing ever. The dumbest thing ever. But it's very hard for Italians. I've spoken to a couple of mates there. And, they live in apartments. And so getting out every day for what they call the passeggiata, or going to the gelato shop or the cafe, isn't just to get a gelati or just to have a walk or, just to have a coffee. It's to get out, to get fresh air, to get out of that restricted environment that apartment living offers. And now they can't do that. So it's very, very hard for them.
Very hard indeed. Thanks so much for joining us, Amanda. I appreciate it.
It's a pleasure, Chris, and I think the technical stuff up belongs to me.
No worries. We'll sort that out for next time. Amanda Vanstone.